Hi, this week we're going to be talking about the American model for insurance coverage. So, the characteristic thing about the American model of coverage is that it's a public private mixture and that it's not universal. So, we have private health insurance markets. These are mostly for the non elderly, non poor, like the working age population and their families. And it's centered primarily around employer associated insurance. For some portion of the public, there is the public health insurance coverage, which is subsidized coverage for people who are over the age of 65 or have a disability through Medicare, and also for people with low incomes through Medicaid. We'll talk more about those later. Um, and there is private provision of healthcare services. Doctors, hospitals are independent or owned by private corporations. There's not a lot of regulations about where they're going to open a practice or how much they're going to charge. So patients, in the sense, like ideally, the way that we think about the model is that patients have kind of a freedom of doctor. If you have good coverage, you have freedom of doctor, hospital, and insurance plan. And doctors have a lot of freedom in terms of how much they're going to charge, where they will practice, and who they're going to see. That can be less so with managed care, which has been kind of inching further and further into the market over the past couple of decades. So first, we'll just talk about employer-sponsored insurance and how that works. So most people in the United States who have insurance coverage, especially below the age of 65, have employer-sponsored coverage. And that might change through the coronavirus as, the unemployment rate has already approached greater than 10%, between 10 and 15% as of the first week of April. So this can change. But the way, up until now, most people in America have employer-sponsored coverage. And it's not exactly free because your wages are lower, because your insurance is kind of part of your total compensation package from the perspective of the employer. It combats these issues of adverse selection because there is this exogenous kind of reason for everyone to pull together. So everybody's here just because they want to get that job, not because they have a particular level of illness. So everyone is able to pool together their risks and share it widely across everybody in the firm. But people are not all going to have the same level of risk. So imagine, there's 4 employees, 2 are young, 2 are old, and the younger employees have lower expected expenses, let's say, which in general is fairly consistently tends to be true on average. So this firm is likely to use a wage pass-through to kind of charge the employees for their premiums in terms of just like lower wages. So the younger workers pay less, meaning their wages are not docked as much for that coverage as the older workers. And it doesn't only have to be related to age. It can occur anytime that there is like an ability to observe an elevated potential for like risk, for medical expenditure risk. It is technically illegal in the United States, but it can be difficult to detect at the individual level. Maybe that's just their salary. But there is some evidence when you look back that this tends to be the case. So there was a law in 1976 that employer-sponsored coverage has to cover maternity care. And then in the years following that law, they found that wages of women of childbearing ages were falling relative to their male counterparts of the same age, as well as women who were older than them. The same thing in labor markets with respect to obesity relative to non-obese persons, their wages tend to suffer because it's just like something that, an employer observes. So, one of the reasons that they are able to avoid adverse selection is through the differential wage pass-through, so that they're not putting too much pressure on lower expected expense employees. But another one is because of firm-specific human capital. So it's not that easy to just up and leave your job when you want a different kind of health insurance coverage. You have developed an expertise, perhaps, you know how things work here. And once you've built up that information, you're more valuable to that firm than you would be to another firm, even where there's two of the similar jobs, similar tasks, maybe similar skills required. The job you're already at is going to be easier for you to do work at. So because you have developed a kind of human capital expertise that's specific to the firm. So what ends up happening is something that people refer to as job lock. It's this combination of the fact that you're getting your health insurance through your job, and your wages tend to be related to your expected expenses, but there's like a stickiness. So sticky wages means that whatever your job is, if all of a sudden you get some kind of diagnosis, like you find out you have cancer or something, they're not going to cut your salary. But it might be harder to change jobs because your new employer might observe your health status and be able to do that wage pass through in a way that your current employer would not be able to. So it's not going to be easy to leave. For an example of how that might happen, let's say that a person has been diagnosed with multiple sclerosis and is in a wheelchair. As the disease has progressed and it's become observable to his employer, the employer wasn't really able to just cut this worker's pay. But let's say that they've found another job opportunity at another firm that they would prefer to be at. They'd be happier and more productive at that other firm. But that employer knows that they're going to have to add this person to their insurance plan and that it's going to be expensive. And they might offer them lower wages as a result because the total compensation package would still be comparable to their other employees. Well, this worker won't necessarily want to take a pay cut. So they'll stay at their current firm for the higher wages, but be less happy and less productive than they would be if they could have left, and their insurance wouldn't have been affected. It's hard to really know what effect I think that this has. I mean, in terms of what they've been able to identify, it might reduce voluntary turnover by about 25%, but overall, we really can't say that it affects GDP in a really big way. It's kind of hard to know, I think. But there is no strong evidence that this is a widespread expensive phenomenon in terms of the economy, but it is a feature of the employer-sponsored market. There are some policies trying to mitigate that. Like COBRA, if you leave your job, you can take your insurance with you, but COBRA is pretty expensive. I don't know if you have any familiarity with it, but it's usually in the several hundreds, around $1,000 a month at least to continue your coverage because your employer is no longer contributing on your behalf.